Yep. Absolutely.
All right. Robert, you were asking me this. Like, I'm going to ask Brennan. Brennan, what are the big reality shows right now? I'm not as huge into reality shows as I used to be. Is there any
I'm
big
the
ones?
perfect person for this.
Oh, okay. All
What
right.
do you watch? What do you watch?
I'm watching Traitors right now.
Traitors?
Yes.
Traitors? Like,
yes.
That's
It's
a
like
reality show?
It's on Peacock.
Oh, I don't get Peacock.
It's like they take people from other shows and they're on it. So like I really like Big Brother. That's my favorite
nice.
show.
Okay.
Yep.
Love Island is a huge one.
Yeah. Is The Real Housewives still on?
I think so, but I haven't really watched much of that.
Okay.
Yeah.
All right.
So one of the granddaddies, Survivor, right? Isn't it like 50th anniversary coming up? And they're bringing back a bunch of old...
It can't be the 50th year. Maybe the 50th episode.
50th season.
Yeah, maybe the 50th
because
season.
like, yeah,
But what
that
do
would
they
be
do, 2
before.
per year? So it'd be 25
I
years?
think so, yeah.
Because I think Survivor started around 2000.
Yep. So
Yeah.
who knows?
That show's still on?
Absolutely, I guess so.
I very rarely watch network TV.
Yeah, same to me.
Well, talking about reality TV, Real Housewives. I have to admit, I actually used to watch The Real Housewives of Beverly Hills, and then I watched a couple of the spinoffs, and then I kind of lost interest. But
Right.
But this first segment is actually about one of the Real Housewives of Beverly Hills, Brandi Glanville, who was on social media this past week talking about her facial parasite and how she apparently has beaten this.
Wow.
And I saw this and I was like, facial parasite. Okay, interesting. Gonna have to dig into this because we don't get a lot of parasites in the United States in humans.
Yeah.
It's not common, but worldwide, it's kind of a big deal. And so, anyway, so she's 53 years old. Brandi was posting, and she was actually thanking a Dr. Nikolai, who's a plastic surgeon out in Los Angeles somewhere. I've never heard of him. But she was publicly thanking him for helping her get her appearance back.
Okay.
Because for the past year, she's been talking about this mystery illness that she's had, which has affected her face as well as some kind of just general symptoms she's had. And she was really frustrated because nobody could give her a diagnosis.
Right.
All right?
Right.
So she eventually came out and said that they thought she may have had a facial parasite. And I was like, okay, interesting. Because she did actually travel to Morocco for one of the Real Housewives reunions.
Of course.
And so I was like, okay, let's think about this from a scientific standpoint, because she's never had a diagnosis made.
Right.
All right, so I'm like, okay, could she really have a facial parasite? And we'll throw that picture up in a minute, but not just yet. Is it possible she had a facial parasite from traveling to Morocco? So I thought that this was possible, but I had to actually do some research because I'm just not up to speed on my parasites.
So I was going to ask, what is a facial parasite? Like, I mean, because you think, like in Aliens, it lands on you or something like that.
Right, so there actually are a ton of parasites that can infect this skin.
Right.
But not all of them are in Morocco. Some are like, Southeast Asia, some are South Africa. Morocco, of course, is very North Africa. I think it's right on the Mediterranean, if I remember correctly.
Yeah.
So I was like, all right, are there any what you would call cutaneous or skin parasites that are endemic to Morocco? And the answer is absolutely yes, there is.
Okay.
There's one called leishmaniasis, and when I saw the name, I was like, yeah, I remember that from medical school.
Right.
I've never diagnosed a case of leishmaniasis, although I do get skin stuff from time to time, so it's not out of the realm of possibility. But there is a parasite called leishmaniasis, and I actually have a picture throw the next picture up there, Brennan. It's going to have a picture. Yeah, okay, so the parasite's on the left.
Okay.
The little flagella-looking thingies.
Right.
And then on the right is a sandfly. And the sandflies are what transmit the parasites.
Through their larvae or their eggs or what?
I think that they're in their little, like the same way mosquitoes transmit malaria through the little biter part, the proboscis.
There you go, biter. I
think it's called a proboscis. Is that, Brendan,
exactly.
Can I get a fact check on proboscis? Is that the correct term for
I have no idea.
I'm sure it is.
Snout? I think it is.
I like biter.
Biter. No, that's kind of
But
lame.
I like that. It makes sense. Like the mosquito, because it'll have some leftover blood or whatever.
Right. So that's how these things get passed around.
Ticks with Lyme disease and all of that stuff.
So leishmaniasis is a thing, and it actually can infect the skin because some parasites, get into like your gut.
Yeah.
Like tapeworms. Like you're not gonna have tapeworms in your face.
Yeah.
But you can have leishmaniasis in your face.
Interesting.
And then the next question I had is, okay, we've established that there is possible that she could have gotten a facial parasite in Morocco. Is it possible that this went undiagnosed for however long it was, like a year? Okay.
How would you diagnose that?
Well,
how would you know?
If you're a doctor in Morocco, it's like top of your list when you see somebody with something on their skin.
Yeah.
But when you're in the United States, it's like not even at the bottom of the list. It's like on a piece of paper that's in a different room.
Yeah, I mean,
unless they happen to mention, hey, by the way, I just got back from Africa, and then you might think, so how could this all have played out? Well, there actually is a plausible way.
Okay.
If you get cutaneous leishmaniasis, it's going to make a wound on your face that's going to be like a non-healing ulcer. And I have a picture. Throw up the next one, Brent. I want people to see what leishmaniasis look like in case they get it. So
interesting.
Obviously, that's not her. This is a patient, from some resource on the internet. Yeah, a journal article or whatever. And if I saw that come in, I wouldn't necessarily think parasite. I would run the normal things that we think of in the United States. Things like skin cancers would be high on our list. Things like autoimmune diseases would be high on our list because these are things that we see. But I would not be thinking parasite. And so it's definitely possible that she could have had something like that on her skin, although there's no pictures.
Right.
She didn't post pictures of her with this thing on her skin. And she went to the doctors and they just didn't think parasite because maybe she didn't mention that she was in Morocco or Africa or wherever.
Right.
And then what can happen is this thing can cause scarring on the inside. The body can clear the leishmaniasis on its own, and it actually does very commonly. If you know you have leishmaniasis, there's some very easy treatments you can take, but the body is actually pretty effective in clearing it. But the thing is once it's cleared, there's no kind of like after the fact test.
Yeah, how do you know?
Yeah, you don't know if you had it, right? So, okay, again, is this all plausible that she could have got a facial parasite? Yes. Is it possible that she could get back to the United States and have it be undiagnosed? Yes. Okay, now could it cause her to have the look that she did? So I'm going to throw that picture up, the next one, Brenna, that's her kind of like right in the middle of this. And so when I look at this picture, and of course I'm not like beating her up about her looks, we're just trying to kind of make a diagnosis here. I mean, she has a lot of atrophy of the adipose or the fat tissue in the cheek, like the cheek's really hollowed out. These kind of like indentations are indicative of scarring. And so
possibly that's maybe where it was or whatnot.
Right.
So let's just say,
Yeah.
She goes into the doctor, probably gets sent to a dermatologist, 1 or 2 or 10. What are they going to do?
I think it depends.
Put some cream on it. Let's see.
Are you talking about when if she had a lesion?
Yeah,
they would probably biopsy it, but you have to be specifically looking for parasites, otherwise it'll get missed because we just don't test for parasites. We just don't have them here in the United States enough to, at least that type of like cutaneous stuff, to test for them. So I mean, yeah, it's totally possible that it's theoretically possible that 1, she could have had it. 2, it could have been a misdiagnosis. And 3, it's possible it could look like that. I mean, that would be a really severe case because that means that it didn't just affect the skin, it affected the soft tissue in her face and it caused scarring and atrophy. And is all that possible? Yes, it's possible.
Right.
Now, is it likely? I don't think so. I mean, people have been weighing in on this, and so the way I see it, because I think about these things like, what would I do if I was a doctor? And as a plastic surgeon, I do see skin stuff.
Right.
And so if somebody comes in with some weird skin thing, I'm going to do the normal stuff. And if I still don't have an answer, then you start looking for zebras. And so what that means is...
the normal stuff, sorry to stop you.
No, you're fine.
You're going to do like a biopsy.
A biopsy for skin cancer.
You'll check, right.
A culture, see if we can get a bacteria to grow off of it. Check for autoimmune stuff. Like the things that are the usual suspects.
Yeah.
But there's a saying in medicine that when you hear hoofbeats, it's usually a horse, not a zebra.
Interesting.
But sometimes it is a zebra. So if your first round of tests, don't turn up an answer, and this thing's not going away, then you're going to start to expand the search by saying things like, hey, have you traveled outside of the country? I mean, I like to think I'm a pretty sharp doctor, maybe slightly above average, but I think that any doctor is if they can't get a diagnosis, is going to kind of go down that road of maybe this is something more rare.
Absolutely. I mean, that's on all of our forms now because of, the previous things and travel and everything else. And so, have you been outside of the country? Have you done this? Have you done any trips? It's like, yeah.
Right. It's like,
we see this
you've
all
been
the
to
time.
Africa. Oh, okay. So maybe we
Where'd
should
you
like
go?
test for like weird stuff. Yeah.
Yeah, exactly.
So although I do think it's 100% possible that what she's thinking that she had a facial parasite, is it possible? Yes, it's possible. Is it likely? No, I don't think so. I mean, I don't know what she had. There were people saying that it was some like aesthetic procedure gone awry, which is definitely possible as well. I mean, that's certainly on the table that, for example, if she'd gotten like some sort of injectable filler that got infected, like that would completely look like she looked on there.
Right.
Now, is that common? No, it's very, very rare, but is it possible? Sure.
So do you think it looked bilateral, like on both sides?
No, it looked like one side looked worse to me.
Okay.
Which kind of makes more sense that...
That's more on the...
Well, I don't know, because I mean, it would be unusual to get filler infected on both sides. So even if it was something aesthetic that went wrong, it certainly could be one-sided, unilateral, however you want to say it.
Right.
But yeah, and so, all right, well, they fixed her. I think she had a bunch of things. Throw up that last pic there, Brennan. This is her most recently at, I think the Grammys or something. I can't, whatever was just happened. What happened, Brennan, like last week? Was it the Grammys?
Oh, I can't remember, but I was going to say she is on Traitors that I'm watching right now.
Oh, she is?
Oh,
yeah,
nice.
but she's on season 1.
Oh,
and
okay.
because I just started it. There's 4 seasons. I don't know what year it is, but I just made that connection. I was like, oh my gosh.
That's her.
I knew she looked familiar.
Yeah, how does she look? Does she look normal?
Looks normal, yeah. She looks like how she looks in that first photo.
Yeah, so...
Well, I think it's worth, I think it's for educational values, but okay, if she came into me with that picture that was like her with her face kind of, not looking so great, what would I do? Well, I mean, I'd want to restore the volume, do something like fat grafting to restore that volume, to kind of, pull out those areas that are kind of sunken in. And then it looks like she had, some cutaneous, irregularities. Then I'd probably laser, her face.
Right.
And I mean, I think what she had was definitely fixable, and obviously it is because, I mean, she looks normal in the photo as far as like she doesn't look like she's, been attacked by some facial parasite.
Well, and I guess maybe because it looked kind of, both sides of the face. There was
it looked like she had a lot going on.
But she could have lost a lot of weight or been
sick. It did look like she was
or,
very thin in that picture.
The Ozempic face, I don't know.
Again, I really don't think she had a facial parasite. It just doesn't click. Is it possible? Sure, but it just doesn't click for me.
Yeah.
And so, I don't think she's, trying to deceive people or whatever, but it just, who knows what she had.
She looks great now.
Yeah, she got it fixed. I just feel bad. Apparently she was really, really in a bad way for like a year.
Yeah.
Spending money trying to figure this out and not getting any answers. And so, I definitely empathize with her.
Yeah, no, that's always the hardest part when you can't get an answer. What is this? We don't know. And so you just treat the symptoms. And so that does stink, but she's on the up and up.
She's on the up. She's on the rebound.
There you